COVID-19 grant. Most significant change story. Christian Health Association of Ghana, CHAG, CHAG.
When the alarm bell sounded for COVID, we really didn't know what to do. It became an emotional thing. Health workers coming to work, what were they coming to face? What would they be taking home to their families? So it was a situation of panic.
Reverend Father Francis Oting Domfe, Administrator, St. Luke Catholic Hospital, Apam, speaking.
CHAG, realizing that, sought to give psychosocial support. In that way, the fear was minimized, and then we were able to confront it as any other disease condition.
CHAG is a network organization of 344 health facilities and training institutions under 33 different church denominations.
Mavis Donko, Project Assistant, Christian Health Association of Ghana, speaking.
Our mission is to promote the healing ministry of Christ and be a reliable partner to the Ghanaian system. It appears that the attention for us to provide psychosocial support for those that were affected by the pandemic were neglected. So we collaborated with the Ghana Somibu Jumidie to organize training for mental health nurses and the institutions to help support COVID victims and their families.
CHAG, with the help of Ghana Somibu Jumidie, organized sort of refresher course on psychosocial support.
John Evans Fifi Ansa, Senior Mental Health Nurse, St. Luke Catholic Hospital, Apam, speaking.
It was a good program. It's really built some of us.
And once capacity was built, he came knowing what he could do and what he would put in place to support staff and then to support patients as well.
When I came, I also organized a workshop with the help of CHAG for all the mental health staff in the facility and even other general staff.
And he rolled out a number of activities reaching out to people who got the COVID to help them deal with the situation and make themselves available for care.
On the 7th of March 2021, Apam experienced a tragic situation, and this led to about 14 dead.
Yante asampapa yenu ambima kokogwale nsuno birumu nsuno fa hwan.
Kolpenying Fisherman, Apam community speaking.
Be no ne baasa de ko ne yenwula mofamba no wo gwal wo na na apa na nyim nti yenwunda bimu de minka wo nu amune bimu nsuno de woko yakro yansa kan nyimpa ebien na oda ya de woko hospital.
Sunday no anapano mabano ko Sunday school nso oba na meka achende yesu yeko mpenyifuna yaba.
Faustina Einusin, mother of deceased at Apam, speaking.
Nti meba no mehunu wo fi by 4 to 5 na ben baby bakade isnana Christopher na we ko grab me olo okwa nan papa okure de okwahwehwe afre nti wo okwahwehwe na we hu
Oba kan bia obi aba na ola na ba kan nti anapa no na wode yafa kanu first one ya tu yimpa kol ya kire no esan ya ko tu yimpa biom nso ya kire no esan wo ina wa ede na we wuwu.
When we heard about the tragedy during the pandemic, CHAG as a mother network, we have to come in to support the hospital.
In collaboration with the Ghana Psychology Association, we first met those who were involved. We segregated them into those who survived and their parents, those who died, their parents, and the rescuers. We also grouped them into one group. Then we offered them general psychosocial support and counseling. Whilst the counselors were doing their areas of counseling, we were also identifying the possible mental health problems, challenges that they are likely to experience. Then we were also touching on it. So one psychologist, one mental health nurse, then we were attending to them on daily basis. So when they left, we, the mental health nurses in the hospital, we had to continue with the follow-up. So we were following up on them in their homes until now that we can say that they are doing well.
No, but since I hospital for Bamami and Santa Mama. I'm a pro, matter chap within more once a woman, 1 year casta fat, more fun banner. No man of which was signed baby. So, hospital of 9 months, Santa Diana.
The impact has been good because such situation, it can lead to a very common condition we call post-traumatic stress disorder, whereby the person will dwell on the situation and the situation will haunt the person to the extent that some people may not even be able to stay in their houses. They will have to relocate. Sometimes they have to leave even the town. But as at now, we don't have any story of that nature. I am even glad to say that some of them, they have recovered to the extent that one has even given birth, one is pregnant. It means that they have moved on.
I'm a sincere, I can't say first. But I feel me now, being to see our friend. I feel him as I may have been no class.
When people lack knowledge, action then is in want. In terms of training, in terms of capacity building, that is where I'll place my thumbs up for them. Somubi has empowered us.
It's prepared all the staff for such a time.
Some of the nurses that were trained, we've capitalized on it. They've become resourced for CHAG. We are using them for trainings to train other facilities that did not have the opportunity to be enrolled onto the project. Now we've extended the psychological support to all our network, of which trainings is ongoing, and we are even providing for the religious and then traditional leaders as well.
We are even making sure that even in the general department, like the female ward, the male ward, there will be somebody who is trained in psychosocial support, so that even before there is anything that they will call on the mental health staff, there will be somebody who might have done what we call psychosocial first aid, then who will go and maybe give a broader management to the person. So going forward, it is going to affect the work not only in the mental health department, but I think in all the other departments.
We can't thank CHAG enough. The leadership, the coordination, the direction that it has given in terms of our response to COVID. There's been so much difference with the psychosocial support that our staff had in terms of training and in terms of capacity building.
CHAG is grateful to the support that was granted them by the Ghana Somubi Dwumadie.
Special thanks. Christian Health Association of Ghana, CHAG, CHAG, John Evans Fifi Ansah, Mavis Donko, Reverend Father Francis Oting Domfe, Kolpenying Faustina Einusin.
Ghana Somubi Dwumadie, funded by UK aid from the British people. A Vessel Media production for Ghana Somubi Dwumadie.